You are watching McLaren Port Huron Today's Health program, and I'm speaking with medical physicist Ben Catt about his role in treating patients at the Barbara and Karmanos Cancer Institute at McLaren Port Huron. Ben, thank you so much for joining us today.
Thanks for having me.
Yeah. So tell us about what is a medical physicist?
So a medical physicist is basically a physicist that specializes in radiation interactions. So in particular, it deals with the radiation's interactions for medicine. So I deal with, in our clinic, I deal with the linear accelerator, how the radiation is produced, and then how those interactions occur to give the patient the treatment that we want.
So Ben, what type of education is involved?
So I have a master's degree in medical physics, and then I've completed a 2-year residency as well.
So how do you interact with the patients in the cancer center?
I don't have too much direct interaction. I'm mostly behind the scenes. So when they come in for treatment after they get their CT simulation done, I'll work with the doctor, and then we'll make sure that we're targeting their tumor correctly. So we use a lot of different imaging studies as well, like a PET and MRI, and I make sure that those are kind of linked together properly so that when they're drawing their volumes, they're accurate.
So we've talked about in other segments how the care for radiation therapy is very individualized. So you talked a little bit about how you put it all together. Can you expand on that?
Yeah, so we bring in a lot of different imaging studies that they have done prior, and then when we take our CT simulation, we fuse them together. So when the doctor pulls it up on the screen, they can toggle between the CT simulation and, say, the PET scan and see exactly where the tumor is at. So one of my responsibilities is making sure that that fusion is accurate, because the insides of a body is never the same day to day. So there's going to be little discrepancies, and we have to make sure that the area that we're interested in looks accurate.
So can you give us an example of how the treatment is targeted or individualized?
Yeah, so if we have a patient come in with a lung tumor, we'll do what we call a 4D CT, which is basically like a normal 3-dimensional CT, but we have that 4th dimension of time movement involved as well. So it's kind of like a video of the insides of the patient. So where the tumor is in the lung, it might move different amounts. So we have to look and analyze and make sure that if they weren't breathing correctly during the CT simulation, there can be some artifacts in there as well. So I am involved in that process in making sure that the 4-dimensional reconstruction is as accurate as it can be, and the area that we are targeting the tumor in looks as good as it can.
And so when the treatment is being administered, so when the radiation, you talked about lung cancer, so people are breathing there, so are there like some safeguards that help protect that healthy tissue that you don't want treated?
Yeah, correct. So for some of our treatments in the lungs, if there's too much movement, we will actually gate the beam. So as the patient inhales and the tumor moves out of the region that we're treating, we'll turn the beam off. As they exhale, it's kind of a more stable time period during the exhale, so we'll turn the beam back on during it.
So really the technology for radiation therapy has really advanced. I mean, this is something that's relatively new?
Yeah, it's fairly new. There's tons of technology in our radiation oncology, so we've got lots of computers and different devices which are watching the patient at all times.
That sounds amazing. Is there anything else that you would like to add?
Sure. A lot of the times patients don't see me at all, but I do a lot of quality assurance testing behind the scenes. So every month I do numerous tests. So I check over the linear accelerator. I'll do mechanical tests to make sure that everything's rotating and moving around properly. All of it has to be accurate to within a millimeter for these treatments to be as accurate as possible. So mechanically, do all the tests for that. The radiation tests as well, I have to make sure that the output is correct and that the quality of the radiation is the same as it is month to month. And then all of those imaging systems that I mentioned as well, there's various testing on that too.
That's amazing. So really a lot goes into it and continues. It's not like it's a beginning treatment plan. It can change throughout the course of the patient's treatment.
Yes.
Yeah. Well, thank you so much for sharing this information with our audience. I appreciate that.
Thanks for having me.
And thank you for watching McLaren Port Huron Today's Health program. If you have questions about our program, you can call us at 1-800-228-1484 or email us via our website at www.mclaren.org www.mclaren.org/ph contact. You can order a free copy of the program and access reliable health information through our website at www.mclaren.org/PHTH. As always, be sure to tune in next week for Today's Health. Today's Health is brought to you by McLaren Port Huron, doing what's best.